We don't care about your race, religion, sexual orientation, how old you are, or whatever. We're here to help you because you're a child of God.
They come from households where maybe, dad or mom's making the house payment and they're putting food on the table, but there's nothing left for medical or dental care.
There are young mothers who can't afford insurance. There are elderly people who can't afford insurance. There's a broad spectrum of people that come and use the clinic.
I mean, the insurance rates are so high, people, they can't afford anymore.
St. Elizabeth's is basically, it's family practice. So we see everything from little babies right after they're born to young kids for their well child checks, or people who have diabetes, high blood pressure. We see people right now who have waited a long, long time, who are many times very, very ill just because of our economy.
I never thought I would be at a point in my life where I actually needed help from the system. But my experience here was completely different. I felt very comfortable. Nobody was judging me.
I can find people who speak Spanish, and everybody always helped me, so I feel comfortable to come.
And I'm glad that God sent me to St. Elizabeth's because I get the best care here. You couldn't get better doctors to help you. And it's great that they volunteer their time, because without that, I don't think Joseph and I would have had such a good experience for a late life pregnancy.
I would think that you want to help someone else improve their quality of life. And volunteering is definitely a great way to do it, especially at a place like St. Elizabeth's, where we handle low-income families, people who don't necessarily have the help they can get from larger or, more expensive organizations.
We have a huge resource of our volunteers who are dermatologists, cardiologists, and ophthalmologists. They come every week. They're just incredible, and they see our patients for free, and our patients would have never had that opportunity.
It's a place where you see patients who appreciate what you do. There's a staff that helps you in every way to make things easy for you to practice there. And it's giving back to the community, which has given so much to us.
And a chance to see a patient population that really needs what we have to offer, and also just to feel the gratitude from the patient. I mean, it's just a full circle all the way around.
From day one, you'll feel the love, not just from the staff, but from patients as well, the gratitude that they feel for your help.
That's the most rewarding thing you can do. I mean, we all work hard, and sometimes, when you first start out, you're trying to measure your life by how many dollars do you make? How much can I buy? And it doesn't take people long to figure out, that's not what's making me happy. So to be able to come down here, that's what makes me happy.
It was just such a great place to work. Everybody here is glad to be here. They want to be here. They're out for the patient's best interest, and you really feel that. We have x-ray facilities. Our lab is great. If you haven't seen and experienced the clinic, come down. Let us take you around and show you this beautiful facility. It's a wonderful place and really offers quality care.
The doctors here that volunteer their time, they're awesome. They're awesome.
St. Elizabeth's is a place where I think it can make a huge difference in people's lives. I feel as though the quality of health care is just as good or better because of the time that we take with the patients. And also the staff here, they go overboard, from the receptionist to the people who register these patients to the medical assistant who might be the first one to listen to this person.
Es una calidad de primera. No sé, yo les pondré un 10 porque así, aparte de que no es mucho el costo, dan un servicio de mucha calidad.
Whenever I needed something, I came right here, and they took me right away, and I got the treatment.
And I had breast cancer, and it was a very aggressive breast cancer. So I think if I hadn't come to St. Elizabeth's, I probably would have waited. I was able to come, and they helped me at a very critical time in my life. I'm here, and I'm glad I'm here. And if I hadn't done this on time, I probably wouldn't be here.
They let us give something back to them, our appreciation and our love and our kindness and the joy that we get from them volunteering their time.
It could have been bad because it could have been cancerous, but it wasn't. And I made a vow to myself that when I grow up, I will put all that effort just to be a doctor and to help people who helped me.